Sam. Well, innovative surgical techniques continue to evolve in the medical field. Among the latest in spine surgery, a procedure that allows doctors to tailor spine surgery specifically to a patient's needs. Neurosurgeon Dr. Vijay Yanamadala with the Hartford Healthcare AIR Neuroscience Institute is the first neurosurgeon to perform it on the East Coast and only the second in the world. Doctor, welcome.
Thank you very much for having me.
Thanks for being back. So when you tailor surgery to a patient's needs, what does that entail?
So most of the time to date, when we do spinal fusions, we typically use standard implants that are not necessarily tailored to a patient's own spine, patient's own anatomy. Today, what we're able to do is using high-resolution CT scans, we can actually create a 3D printed implant for the patient's own spine that fits to their spine like a glove. And the reason to do this is, there are complications in spine surgery like failed fusions, graft subsidence. These are the issues that we're trying to prevent through patient-specific implants where the implant is designed for that patient's spine.
Very interesting. All right, tell us about your first such surgery. What was the goal?
Absolutely. So I had a patient who presented to me after several previous fusions that had failed. He even had a spinal cord stimulator placed, but was still having severe leg pain and back pain, really unable to walk. So we designed a 3D printed patient-specific implant for him to actually carry out the revision fusion. He's now doing great. He's actually made a good recovery now several months out.
Excellent to hear. All right, we also understand you're performing cutting-edge awake spine surgery. That sounds a little intimidating. How does that work?
Thank you very much for asking me about this. Actually, I think one of the things we know is general anesthesia is a risk no matter what you do. We are trying to bring awake spine surgery where patients do not have to undergo general anesthesia to have spine surgery. So patients undergo spinal anesthesia with a nerve block. We have done this on a number of patients now at St. Vincent's Medical Center under the guidance of our excellent anesthesia team. So these patients wake up like they've never had general anesthesia. And it's remarkable. We know that it cuts their recovery time in half, it cuts their operating time, it cuts their time in the hospital. So ultimately, awake spine surgery affords patients the same spine surgery without general anesthesia.
That's amazing. Quick last question. Who's a candidate for this kind of spine surgery? Do you see more older people?
I have now done, I've now done awake spine surgery for patients from 26 years of age all the way to 84. My 84-year-old patient came to me after searching for a surgeon for 2 years because she had bad reactions to anesthesia. So she really could not have general anesthesia. My 26-year-old patient really wanted to avoid the risks of general anesthesia. So bottom line, anyone who'd like to avoid general anesthesia is a candidate, and we're now doing this actively at St. Vincent's Medical Center.
All right, Dr. Yanamadala, thank you so much for joining us. For more information, go to hartfordhealthcare.org/spine wellness. Thank you.
Thank you very much.